At North Shore, we use the Level 1 Equator brand of convective patient warming. There should be one in each OR on one of the IV poles. We stock both upper and lower body blankets on the back of the anesthesia carts. Those blankets are kept right here on the top by the red arrow. We try to place these convective blankets under the patient blankets so the warm air actually reaches the patient. Be careful with the adhesive on them because there have been skin tears in the past when taking the blanket off. So we try, if possible, to put the adhesive on top of the gown instead of the patient's skin. Turn the machine on here by the red arrow and be sure to pick a temperature setting that's circled here. If you don't pick a temperature setting, the default is cold room air, so you definitely don't want that. So then all you have to do is hook the hose up to the blanket, and that's it.